Hi everybody, and welcome to 24MK. I've just finished one of my rounding visits at the cardiac catheterization lab here at Bay State Medical Center. Rounding is kind of visiting and learning about where people support or deliver patient care. I have a schedule where for 3 or 4 hours each week I visit one of 120 different places, and I always learn a lot about the nature of the work you're doing and some of the special challenges that you're facing. So I appreciate it very much, and it's something I really look forward to. Now let's get to your questions. The first one is from Terry Steck, who's a surgical system administrator at Bay State Medical Center. She asks, what is population health and how is Bay State Health addressing it? Well, population health is the way that we're actually paying for and delivering care more and more these days. It has to do with taking a group of patients and assigning them to a group of primary care doctors. We develop a global budget for the care of those patients, and then we're required to deliver on certain quality measures having to do with the delivery of evidence-based care and preventive measures, etc. Population health and the assigning of a budget really incents the doctors and the hospitals to think a lot more about things like preventive care, wellness, keeping care well coordinated, as well as keeping care in the system. When we do that, we can deliver high quality care at a lower cost, which is why a lot of these population health ideas were advanced in the first place. The second question is, have I ever done a digital detox, no phone or computer screens, and what did I think about it? Well, I have to confess that it's kind of hard for me in my job to disconnect completely from email and phone messages, etc. Even when I go away on vacation, I'm usually checking in once a day, and it's, I guess, kind of an occupational hazard. But there are a couple of things I do that try to reduce some of the hassle and stress related to always getting pinged and always being distracted by computer screens, etc. The first is I made sort of a policy that if somebody sends me an email, I'm going to give myself a day to respond. So that way I'm checking my emails 2 or 3 times a day, and I'm able to bunch them rather than checking them every 15 minutes, which I think is very distracting and really can drive you crazy. The second is, believe it or not, I practice mindfulness, really trying to focus on the moment at hand and not worrying about what's going to happen 2 hours from now or what happened 2 hours ago. So in a sense, I'm kind of doing mini cleanses throughout the day, although I've never done the big one that you referred to. So thanks for your questions, and keep them coming.